Great, thanks, Michael. And hi, Heather. Thank you so much for joining us and agreeing to being interviewed. I'm really looking forward to chatting with you. I thought it would be good to just start by hearing a bit about your journey into this field, what led you to focus on these mechanisms underlying the development of major psychiatric disorders, and also in particular the approaches that you use, like neuroimaging and genomics. Yeah, it would be great to hear about that journey.
Thank you. Well, it's a real honour to be asked to speak. So, yeah, thank you very much. And it's been a real honour to serve on the Scientific Advisory Board for the charity. It's a really nice, friendly group and an amazing bunch of students. So, thank you for that. So, in terms of kind of how I've got to where I am, I suppose, I think so. It's not been a straightforward path. I actually started off as a dentist, and then I decided that that's not what I wanted to do. I was much more interested in human biology, so I switched courses, much to my parents' kind of shock and horror. But hopefully they think it's all worked out in the end. But I was much more interested in, as I say, human biology, and particularly in how that kind of brain, the kind of mushy substance of the brain can kind of make us who we are, and potentially put us at risk of various kind of psychiatric conditions. So that's what led me into neuroscience. And when I finished my degree, I was kind of forced with a bit of a fork in the career path, in terms of either going to work for a kind of pharmacological company, or to work looking at brain imaging in psychiatric conditions with Eve Johnston. And that's the route I chose. I felt it kind of resonated much more with me. So that's how I started. And in terms of brain imaging, it became clear really that the differences that we see in terms of brain imaging in relation to the major mental health conditions are really quite subtle. And in terms of kind of really narrowing down into the kind of biology of what's happening, it became clear to me that we needed to also link with some of the biological mechanisms, so some of the genetic risk factors that we know about, in order to be able to understand more about the conditions. I hope that answered your question. It felt a bit rambling, sorry.
Yes, it definitely did. And yeah, it's always fascinating to hear about these non-straightforward paths. I wanted to ask about, you've worked across a huge range of methods and research questions, but I noticed that adolescence seems to be a kind of key focus in your work. And I wanted to ask why. What is it about this developmental period that's particularly interesting to you, or particularly important to understanding mental health?
Yeah, thank you. Yeah, so focusing on the adolescent period is a kind of real passion of mine, I would say. I think when we're thinking about mental health conditions, we're often thinking about early risk factors that kind of put people at risk. But I will feel quite passionate about individuals that are approaching adolescence that already have these risk factors, that we need to be able to kind of have a solution and not see it as deterministic. And from a neuroscience and development point of view, I quite often quote the UNICEF slides in quite a lot of my talks, because that talks about the second window of opportunity to intervene. So we know that adolescence, not only is it one of the major risk periods for the onset of psychiatric conditions, but it is also a significant period of neurodevelopment, and I think a significant period where we can actually intervene and make a difference in young people's lives. So that's why I'm particularly interested in adolescence.
Mm. And also on that topic of young people, I guess there's been quite a push towards involving young people more meaningfully and kind of directly in mental health research, not just as participants, but also as collaborators and co-producers of the research. And I know that you've done that in your own work, so I wondered if you could talk a bit about how you did that, and any advice for doing that well.
Yeah, good question. So we've done kind of 3 studies now where we've involved young people right at the very start, even at the start of thinking about the research questions and the kind of funding applications. So one of those is looking at a feature of depression in adolescents, which is really interesting, and its irritability was what we were particularly interested in. And we wanted to design a study that we could use within the scanner that would tap into irritability, because what we don't know in terms of adolescence, that everyone kind of associates irritability with typical teenage behavior, but when does it start to become a problem, or perhaps an indication that there's something wrong? So we got to ask lots of young people what they find irritable, and actually that was hugely satisfying and quite interesting in terms of what we might feel that they find irritating and what they find irritating. So that was a really interesting and quite insightful study. The two other studies that we've conducted since then with embedded co-production have been looking at the impact of online versus offline social interactions in terms of feelings of loneliness. And we also have a sleep study where we've heavily involved co-production in the work, where we're using a passive radar-based sleep monitor to track sleep periods over longer periods of time. And I have to say, in each of those three different studies, there's always been something unusual and something different that the young people can contribute to the research that the researchers haven't thought of. And you asked about advice about how to do it well. I think the first thing that we did was that we involved somebody from youth work within all of those studies. So somebody who's come from youth work, charity sector, that we involved in all of those YPAGs, those advisory groups, that were able to put the young people at ease, kind of reduce any of the hierarchies, and just to get them to feel at ease and talk to us. Yeah.
Thank you. This is a question that's been asked over the last few years, but I think it's always so valuable for us to hear about. If you could go back and give your PhD self one piece of advice, what would it be?
So I think it would be to be kind to yourself, and to think that the PhD it's not a sprint, it's a marathon, and everybody's path is very different. So don't compare yourself to other people. And I think the major piece of advice I would give to my past self would be that imposter syndrome is real, that it's rife, and that, don't let that stop you from putting yourself forward for things.
Yeah, that's very good advice. Thank you. Can you tell us a bit about a study that you're maybe particularly proud of and why it may stand out to you?
Okay, yeah. So I'm going to pick a very recent one. So just recently we had a paper accepted in molecular psychiatry, and that's working with the Enigma consortia to pull together lots of brain imaging data and lots of genetic imaging data to look at the relationship between polygenic risk score for major depressive disorder and brain imaging data. And this is at a scale that's just not been possible to do without the kind of openness and transparency and collaborations that are kind of now apparent in the research field. So we were able to look at 50,000 scans and compare those to polygenic risk scores. And what we were able to find with that data was that there are associations between increased risk for depression and various brain features. That in younger people, there's an evidence that they are already present, which obviously has important implications for kind of treatment and interventions going forwards. But we were also able to look at causal directionality using Mendelian randomization, which is a technique where you can look at genetic instruments to kind of infer some causality. And there was an indication of a kind of causal link between hippocampus volume and your risk for depression. So that was a really nice study, and I think it's one of the studies I'm most proud of, not just because of the findings and the ability to look at causal directionality, but also because it was such a huge piece of work that's taken a long time and lots of different researchers all working together. And Shen, who's the first author of that, has done a tremendous amount of work putting all that together, dealing with all the governance. So it's more to do with the amount of work that's gone into that rather than the findings in and of themselves.
Thank you. That sounds like an amazing study. I'll definitely be looking that up. I wanted to also ask a bit about impact and scientific communication in general. How do you approach kind of ensuring that your work actually has a practical impact, whether for clinical services or young people or policy? I know that you're involved in this Generation Scotland. And yeah, what advice would you give to us to make sure that our research doesn't just stay in journals, and reaches the people that it needs to reach?
Yeah, that's a really good question, and I think something that probably we all battle a bit with. And I think the answer is trying to engage with policymakers and trying to kind of bridge that link between research and academia and governance. I have to say, I think one of the most impactful pieces of work I've done is looking at brain imaging studies in adolescents and in relation to when the brain supposedly reaches a level of maturity. And this was something that was funded by the Scottish Government because they were interested in thinking about sentencing of juveniles and young people, and thinking about that. I think probably quite forward thinking in terms of the Scottish Government, in terms of thinking, is there evidence to say when the brain has reached its full maturity? And if that's not until what we now think of is of a 25 and upwards, then maybe we should be thinking differently in terms of sentencing young people. And that piece of work was essentially a literature review, which we do day in, day out as part of research. And it probably took about a week or 2 weeks, but that's probably the most impactful piece of work that we've done, just conducting that review and passing that information on to the policyholders, which then changed policy for judicial sentencing in young people in Scotland. So, and you never quite know where these things are going to come from, but I think making those links is really important.
Yeah, absolutely. Kind of related to that, I guess, and very relevant to this charity in general. Mental health awareness has definitely grown in public, but research still doesn't receive the funding that it needs. What do you think helps persuade the public, the funders, of the importance of mental health research?
Yeah, good question. I think just talking openly about it, and I think having lived experience panels involved also kind of has a kind of more grounding of our work. I think just continuing to be present and continuing to interact with the public outside of journals and academia and conferences. Yeah, I think actually that the funders are now kind of appreciating, and there's obviously some of the major funders are really focusing on mental health, so that's really great to see.
Mm. Um, Another question, which is, I guess, more aimed at us as PhD students, is how do you go about building collaborations, especially outside of your own university, and what would your tips be for early career researchers that are looking to do the same?
So my main tip would be don't be worried about reaching out to people. I think in most cases researchers are really enthusiastic and happy to speak to other people. I think in the past it used to be conferences. I think that's probably less so with the pandemic, although that's picking up again. But yeah, first and foremost, don't be shy about reaching out. People are generally really happy to make connections.
Mm.